This combination medication is used to temporarily relieve symptoms caused by the common cold, flu, allergies, or other breathing illnesses such as sinusitis and bronchitis. Antihistamines help relieve watery eyes, itchy eyes/nose/throat, runny nose, and sneezing. Decongestants help to relieve stuffy nose and ear congestion symptoms. If you are self-treating with this medication, carefully read the package instructions to be sure it is right for you before you start using this product. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. Some products are not recommended for use in children younger than 12 years. These products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions. Do not give other cough and cold medication that might contain the same or similar ingredients. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms. When taking child nighttime cold and cough, it's important to follow the directions from your doctor or the product package. If you have any questions, make sure to ask your doctor or pharmacist for clarification. You can take this medication with food if it upsets your stomach, and be sure to drink plenty of fluids unless directed otherwise by your doctor. If you're using the liquid form of this medication, be sure to measure the dose carefully with a special measuring device or spoon. Don't use a regular household spoon, as it may not give you the correct dose. If the liquid form is a suspension, make sure to shake the bottle well before each dose. It's important not to crush or chew extended-release tablets or capsules, as this can release too much of the drug at once and increase the risk of side effects. If you're using chewable tablets, be sure to chew them thoroughly before swallowing. The dosage of this medication is based on the product you're taking, your age, medical condition, and how you respond to treatment. Make sure not to increase your dose or take it more often than directed by your doctor. If your doctor has instructed you to take this medication daily, be sure to take it at the same time each day to get the most benefit from it. If your condition lasts for more than 1 week, gets worse, or occurs with a headache, fever, or rash, make sure to consult with your doctor, as these could be symptoms of a serious medical problem. Some common side effects of child nighttime cold and cough may include drowsiness, dizziness, dry mouth/nose/throat, headache, upset stomach, constipation, or trouble sleeping. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist promptly. If your doctor has prescribed this product for you, they have determined that the benefits outweigh the potential risks. Most people using this product do not experience serious side effects. However, it's important to contact your doctor immediately if you experience any serious side effects, such as mental/mood changes, ringing in the ears, difficulty urinating, or vision changes. Seek medical help right away if you experience very serious side effects, including fast/irregular heartbeat or seizure. While a severe allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed here. Before giving this medication to your child, it's important to let your doctor know if they have any allergies. This medicine may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your child's medical history with your doctor or pharmacist, especially if they have any breathing problems, diabetes, heart issues, or kidney or liver disease. This medication can cause dizziness or drowsiness, and alcohol or marijuana can make these effects worse. It's important to avoid driving or using machinery if your child is feeling dizzy or drowsy. Additionally, this medication may contain sugar, alcohol, or aspartame, so it's important to talk to your doctor if your child has diabetes, alcohol dependence, or any other condition that requires avoiding these substances. Before any surgery, be sure to inform your doctor or dentist about all the medications your child is taking. It's also important to note that children may be more sensitive to the side effects of this medication, especially excitement and agitation. For older adults, they may be more sensitive to side effects such as dizziness, drowsiness, confusion, constipation, or trouble sleeping. It's important to be cautious, as these side effects can increase the risk of falling. If your child is pregnant or breastfeeding, it's important to discuss the risks and benefits of this medication with the doctor. This medication may pass into breast milk, and the effect on a nursing infant is unknown. Always consult your doctor before breastfeeding while taking this medication. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Always keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with child nighttime cold and cough are antihistamines applied to the skin, such as diphenhydramine cream, ointment, spray. Taking MAO inhibitors with this medication may cause a serious, possibly fatal, drug interaction. Avoid taking MAO inhibitors during treatment with this medication. Ask your doctor when to start or stop taking this medication. Tell your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, cannabis, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. Check the labels on all your medicines because they may contain ingredients that cause drowsiness. Ask your pharmacist about using those products safely. This medication may interfere with certain medical/lab tests, possibly causing false test results. Make sure lab personnel and all your doctors know you use this drug. If a person has taken too much of child nighttime cold and cough and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of overdose may include irregular heartbeat, hallucinations, fainting, and seizures. It is important to seek help right away if you suspect an overdose. Remember, if your child's doctor has prescribed child nighttime cold and cough, it's important not to share this medication with others. Make sure to keep all medical and lab appointments as directed by the doctor. It's important to follow the recommended dosage and timing for the best results. If your child is taking this product on a regular schedule and they miss a dose, they should take it as soon as they remember. If it is close to the time of their next dose, they should skip the missed dose and take the next dose at the regular time. They should not double the dose to make up for the missed one. It's important to stick to the recommended dosage and timing for the best results. Remember to store child nighttime cold and cough at room temperature, away from light and moisture. It's important not to store it in the bathroom or freeze the liquid forms. Make sure to keep all medications away from children and pets. When you no longer need the product or it's expired, be sure to discard it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.